Hi, this is James Hunter, and this is my 2 cents channel where I talk about physical fitness, mental health, wellness topics, and just topics I may want to discuss. And yes, that was a shameless bicep shot at the beginning of the video. And today I want to talk about modifiable risk factors and making lifestyle changes. I'm 48 and a half years old, not too far from, I'll be 49 next year in the spring. So I want to talk about my observations, just my cohort or the demographic, the people I grew up with, and what my observations are and what I've seen, and some things that are preventable in terms of people's health and people's premature declining. And what I mean by premature declining are people whose physical health is such to where they are experiencing a decline in quality of life, a disability at times, unnecessarily well before their time or what should be happening for people their age. I grew up with individuals, and this is not a video to take digs at people. It's just just honest observations and truths. Now, people who get late adult onset diabetes type 2, a lot of times it's secondary to gaining weight, being sedentary. They're not getting any type of exercise, any physical activity, if you will. And so what happens is they become desensitized to insulin. Their body, it may still be producing insulin, but essentially it's not doing its job anymore to help break down glucose or metabolize, transport glucose to where it needs to go, and so on. So the blood sugars build up, simply put, right? So they get diabetes type 2. And with that comes different other risk factors, diabetic retinopathy. They can go blind, neuropathy, strokes, cardiovascular issues, heart problems, a lot of things that individuals can be at risk for due to diabetes. I've known people who had some cardiovascular heart problems that were being exacerbated or in some arguably even created by not managing their diabetes based on some doctors I've talked to just at the gym, and people who are in the medical profession who deal with this. They give me their feedback and thoughts on it. So I see on social media, unfortunately, people my age having to go to the hospital and in some cases be hospitalized actually for a period of time due to having a stroke, to not taking, not managing health problems such as not eating accordingly for what someone with diabetes type 2 or type 1 for that matter too, but the type 2 is a situation that occurs later in life. So if these individuals, by changing their diet, becoming active and exercising, definitely a situation where, yeah, you can manage those symptoms. I've had clients that lost 30, 40 pounds, their blood sugars became under control, the A1C became under control as far as being in the normal range. And as far as the other indicators in their lab work, they were had more optimal or more favorable outcomes, if you will, of their lab work, and they were a lot healthier. This was achieved through exercise and diet, right? So these are modifiable risk factors in these situations, meaning that you can do something about it. It's not like you're completely at the mercy of the situation. So I see people, unfortunately, they have these situations. They're overweight or obese, and they'll post what they're eating on Facebook, junk food, fast food, just things that are obviously not a good situation for them, for someone who's not in good health. And it's almost like they're taunting it or making fun of it. In my opinion, it's a way of dealing with their own anxiety about it. They figure they can just make fun of it and that makes it okay if they don't think it's a problem. It's kind of like magical thinking, if you will, or rationalizing, distorting reality. And so these individuals, I'll see them posting, cheeseburgers, fries, cheesecakes, alcoholic beverages, and cigars, smoking, things like that. And these are individuals dealing with serious health problems, serious life issues. They could very well not make it to 50, and it's a serious business. It's not a joke. So there's this issue of denial of the truth and these individuals who have these situations. So modifiable risk factors, it can be smoking cigarettes, diabetes type 2 in terms of the lifestyle changes that can be made to have this, to get the symptoms to disappear or to manage them, keep them under control. I have had some clients that with working with their doctor and communicating with their doctor, they explained what they're doing, that, hey, I started exercising, I'm on a diet now. And so, yeah, they lose weight. And with some of these individuals, they didn't have to take medication anymore. That was managed and controlled simply through a lifestyle change of exercise and eating in a healthier, particular way that supported those goals. So, it's your values. What you value is evidenced by your behavior. So I know individuals who have a lot of discipline in other areas of their life. It could be their career. It may be a hobby, such as they're involved with doing arts and crafts. It may be working on their car. I know people who take better care of their cars than they do their own body. That's the most important vessel you inhabit is your body, much less than a car that you just use for transportation or for show or whatever that situation is. So people who place a value, it's a perception of what they assign worth to. So working on the car, going to sporting games, as football, whatever, going to the bar to watch a baseball game, whatever it is, recreation, social type activities that you derive fun or pleasure from. To you, you assign worth to that. So you'll put your money and resources into it. However, with things that that are, you would think would be your reasonable service, taking care of your body, invest in any type of resource, which your time is a resource, money, it might be a gym membership, maybe hiring a personal trainer, maybe getting a nutrition plan, something like that. You'll find that individuals will not invest any money, time, or resources to that end, okay? So when people say, I want to lose weight, or I need to take better care of myself, pay attention to what they do, not what they say. So if an individual really assigns worth to that situation, they want to lose weight, they want to get their health in control, if it really truly means something to them, you're going to see their behavior follow and support that end. You'll see them make changes in how they live their life, how they eat. They'll start exercising, they'll become active, they'll start investing their resources into that. And even if it's small changes that they occur over time, it's a process. Even if individuals may not have a lot of knowledge in the beginning, if they're serious, you'll see them seek out knowledge. They'll get on the internet, they'll Google information that'll help for them to become educated. They may hire a personal trainer. They may take some classes and so on. So it's just something that I want to make a video about today. I've talked about it in other videos before. Essentially, is modifiable risk factors, things we can do something about. The field of epigenetics talks about how a significant, I think it's 90% or better of our genes are under our epigenetic control, or are influenced rather by lifestyle and behavior, that we can do things to influence that. So our genes, if you will, may think of them like bullets. They load the gun. Something has to pull that trigger, right? A gun, it has the chamber or clip where you put the bullets in, depending on whether it's a revolver or a semi-automatic, pistol, or, pick your firearm you like. You get the analogy. So the bullets, if you will, yeah, you load the gun with the bullets, but you got to pull that trigger for the bullet to be fired. So if you think of your genes or your genetics are kind of like bullets, if you have a risk factor for diabetes type 2 in your family, for people like, men maybe in their 40s, you notice there's a pattern that they get diabetes type 2. They may be people that don't exercise, they don't eat properly. So if you see that pattern, you're like, hey, maybe there's a risk that, men in my family, they get diabetes type 2. Well, that doesn't necessarily have to be you. You may have a higher risk, but something has to pull the trigger for that risk factor. That trigger, if you will, is a sedentary lifestyle, not exercising, eating poor food choices, and being overweight. That pulls the trigger for that gene to be expressed, if you will, or risk factor, however you want to describe that situation. And there's other, things that people are predisposed to, or have a higher risk, if you will. Alcoholism, drug addiction may run in families. But you don't have to become a drug addict. You don't have to become an alcoholic, if you will. It's not an absolute, nor is it written in stone. Your behaviors and choices that you make can either increase your risk to go in a certain direction or reduce the risk and get you going in a different direction. So our choices or behaviors have a very powerful influence in terms of our outcomes. So those are just some of my thoughts on that. There's a lot more that can be said. What are your thoughts on it? As far as whether it's diabetes type 2, people that that you might see, you might be in my situation. You're about my age or older, and maybe you're someone who exercises, takes care of yourself, and you've seen the benefits of maintaining yourself, and your quality of life is benefited as a result. However, you see people your age that you grew up with, it's a different situation. They're just either grossly overweight or they got other issues going on. They're not managing their health needs, if you will, as far as by investing some time to get active, exercise, trying to be reasonable with their food choices and so on. So if you see people like that, for me, that's a reinforcement to myself, like, hey, this is kind of helps me to stay focused, because I don't want to go in that direction. I will say this, is that with individuals like that, I don't, try to be the police, the food police or the exercise police, and, and try to beat them over the head and tell them, hey, you need to eat healthier and start exercising, because it's not an issue of most of the time about knowledge and education. Most people they've been told or educated at some point to some degree that the importance of food, nutrition, and the effect on their health and their body, about managing their weight, the benefits of being active and exercising. So at some point people have heard this. So if that was the problem, then it'd be as simple as just educating people and everybody would be healthy and fit, and we would reduce risk factors to people's health. People would maintain a quality of life and activity, much longer before they started, having some issues that can happen to people as they get elderly, if you will. But when you have people in their 40s already who have the, physical, I guess, physical fitness level, if you want to look at it that way, or are physically the age, if you will, of an elderly person, doesn't have to be the case, and it's unfortunate. People getting out of breath trying to climb a few steps. They can't even get out of the car, can't even tie their shoes. I hear people struggling to breathe, performing just basic activities. So this is a result of just gross neglect of their body, their physical health, excessive abuse of food and overeating, and just inactivity. And then throw in other variables for people who have habits like smoking cigarettes, excessive drinking of alcohol, and so on. So you get the idea. So what are your thoughts on it? Do you know any people like this in your life that you've seen them have some issues? Maybe you've seen people, I already know people that already died that I grew up with due to heart disease. Secondary, in part, to lifestyle choices, no doubt. So do you know people like that? What has it made you think in terms of your own mortality? I know of myself, I realize that I'm not going to live forever, but I have a sense of my mortality, if you will, as I've gotten older, in terms of that being a focus to take care of myself so I can increase my number of years here, and more importantly, my quality of life for the years that I have left. That's very important to me. So looking around, and seeing the outcomes, it's been a something that's helped me to stay focused, and also a reminder of how important it is to take care of ourselves. And just in everyday life, when I go to the grocery store, when I'm out shopping or out, going to a restaurant, just out living my life, you can see the impact that the neglect of taking care of yourself has on people's quality of life. Where I live at, obesity and diabetes type 2 is, I think it's close to #1 in the nation at one point. So anyways, if you are someone, maybe you came to this video because perhaps you're overweight, maybe you're middle age, and you've been diagnosed with pre-diabetes, and your doctor said, hey, you need to lose some weight. They recommend you start exercising. Well, now's the time to start doing something. Today's the time to start doing something. Not tomorrow, not next week, not January 1st. You can start doing some things today. If your doctor says you can begin exercising, you know what? get up an hour early in the morning, start taking brisk walks, and start, trying to build yourself up, 20 minutes, and then 30, 35, before you know it, 45 minutes. Start doing some strength training 3 times a week. You budget that time into your schedule every week, for all the benefits you get out of it, for such a, by comparison, a small investment of your time for what you get for the rest of your life. It's just a win-win situation. It's a no-brainer. It makes sense. So if you like this video, as far as maybe it's got you to start thinking about maybe your situation, or it's helped you to as a reminder, like, yeah, I'm glad I'm taking care of myself. Like the video. I'd appreciate it if you'd subscribe to my channel. I appreciate the support. And if you have any suggestions about maybe some topics you'd like me to make, drop them in the comments below. I like to make topics on not just physical fitness, mental health, wellness topics, and this other things that may come up for discussion. So my goal is to maintain as much quality of life, stay strong as I can, and as active as I can for as long as possible, and doing the things I enjoy. And that's one of the things I'm thankful for, that it's been put in my heart, call it God, call it inspiration, whatever. From the age of, since I can remember, I've always, had an appreciation for physical fitness. Started working out when I was 12 going on 13. So been doing this 35, 36 years. And here I am today. It's worth it. If you're a young person, get busy now with a program. And if you're older, it's not too late to start. I've seen people totally transform and change their lives in their 40s and 50s and so on. So until I make another video, y'all take care and have a good day.